most of us watch on TV, how it is presented. And a student who is watching that in a similar position says, okay, my teacher beat me up. See, this guy has committed suicide because his teacher beat him up brutally. His mother beat him up, father beat him up. I am also going through that same phase in life. If he can commit suicide, I can commit suicide. And that child goes ahead and does that. We don't mind the media reporting it. But while reporting it, please tell your commentators to tell this is not the right thing to do. There is somebody who can help you. If you are in a similar position, please contact so and so NGO, please contact your principal, please contact your friends, peers, talk it over to them. This is what I expect from the media. This is not a very big task we are giving them. It's an humble request that the media has to join hands with the society to play a responsible role in preventing young children from committing suicide. Another important aspect I want to briefly talk about is the state of the mental health system in the country. When I took over this department as the health minister, I had a review meeting of the 4 mental hospitals we have in the state. It's in a pretty bad state. I'm a person who admits what is right, what is wrong. And then I took a decision to appoint a committee of renowned psychiatrists, some journalists, very senior journalists, who are interested in this subject, some NGOs. We have put a committee of 10-12 people together, and we told them, I chaired the first meeting, and I said, I give you 45 days. And in 45 days, what I expect from you is visit all the 4 hospitals, give a status report on this hospital, visit any other institution in the country which you think is a good institution from where you can adopt certain things and implement it in our state, and get back to me in 45 days. The thing is, first I told them, go through the admission process. How is a person admitted to a mental hospital? What are the lines of treatment available there? The counseling aspect to be taken care of. And the most important thing is, besides the food we provide there, the comforts we provide there, all that today is not good, I know. We have asked them to suggest how to improve that. But the most important part, I told them, was to tell us how the discharge procedure should be. I have come across cases where people leave their parents in the mental hospital, their relations in the mental hospital, and just disappear. And then the department says, sir, he is okay, but we can't discharge him because none of his relations are traceable. Is it the responsibility of the state to take care of a person who is above 18 years of age? And can we turn mental hospitals to old age homes? This is a question we all have to deliberate. I know the number of professionals, mental health, you say psychiatrist, you have on the clinical side the paramedic forces, the nursing staff, the paramedical staff. We are short of everything in this country. I don't know, the Medical Council of India in this country it was like the ration Raj. You can have only 2 MS posts, you can have 1 MD, you can have 1 MD for this department, 1 for that. Now they have doubled it. And we have the human resource, but a shortage of manpower. We produce MBBS doctors, but we don't have enough opportunity for these MBBS doctors to go in for post-graduation. But I think our new minister, Mr. Gulab Nabi Azad, is taking care of this. I talked about this a year and a half back in a conference of the Director of Medical Education when Mr. Vilasrao Deshmukh was the Chief Minister of the state. I said, we expect doctors to go and work in the rural areas. After spending 7 years of their life to get an MBBS degree, why do you expect a young doctor to go and stay in a village? And in some cases, get seats after payment. So now the government is coming up with, you might have just read in the papers today, with the concept of having a rural doctor with 3.5 years course. I think we will have enough doctors to man our rural health centers. And those who have completed MBBS, and the number of post-graduation seats are going to go up in the days to come. We are going to see a radical reform in the medical and health services. As far as the state government is concerned, as Mr. Kulkarni said, we had a discussion on this. We have asked Tata Institute of Social Sciences to prepare a report on this subject. The school education department is basically looking into this issue. But as a health minister, it's my duty to interact with all of you. And whatever your suggestions, if we have to put a system in place in the health ministry where this system works 365 days, maybe some good doctors involved in this, good psychiatrists, some NGOs involved in it, people who are dedicated, involved in this, I am open for it. And I am sure this trend will continue in years to come, because it's basically a phenomenon, a thing which occurs in the brain of every human being. So as long as humanity is there, this trend for suicide will be there. So like we have put systems in place for all other disease like diabetes, tuberculosis, our campaign for HIV AIDS and so many other things. We have to take suicidal tendencies as a psychological problem, as a disease, and work out our strategy for this. As the Minister for Health, I am open to meet each one of you at your convenience. All of you are experts in this field. I know some of them. We can meet again, and I'll give you enough time to listen to you, and we are positively in line with your thinking that we should have a system in place to deal with this. I thank once again each one of you for giving me such a patient hearing, and I thank Mr. Kulkarni once again for having taken up this very crucial issue. And I think, let's hope we all put our heads together to bring something out of this seminar. Thank you. Jai Hind, Jai Maharashtra.